The VetOvation Endoscopy System enables the use of both flexible and rigid scopes for diagnostic and therapeutic solutions in your practice. The high-definition camera system enables upper and lower endoscopy to biopsy tissue or remove a foreign object. We also have a smaller version flexible scope for bronchoscopy and rhinoscopy. This is your gastroscope setup. When you plug in your gastroscope, make sure that the VetOvation writing is up. Stabilize your processor a little bit and that will click into place. Place distilled water into your water bottle and that will go to the side of your gastroscope there. This is your signal connector. This, you'll have the end that goes into the processor facing up. And then you're looking for a red dot on your signal connector and that will go into the side of there. And then your suction tubing that goes to your floor suction will go to the side of your scope there. And then you can turn everything on there. This is your light. This is your air and water pump. You can take pictures from here. You can record video from here. You'll always want to white balance your camera. So look at something white like a gauze and then just depress the AWB button and that will white balance your camera. You can review your pictures and video from here. Prior to starting your procedure, I would put the tip of your scope into a water bucket or a dog food bowl and just gently hold over the blue button and that will show you that your scope is giving air and that will help you to be able to distend the stomach as you go into the stomach. If you depress all the way down on the blue button, that will give you water through the end of your scope. Your red button will control sucking the air and the water out at the end of your procedure. This is the setup of your semi-disposable flexible scope. You have two different scope options. You've got a 5.8 millimeter diameter scope and a 3.2 millimeter diameter scope. You always want to have the signal connector facing up. That will plug into here. You'll want to have your suction tubing with a 6-inch segment of IV bag tubing cut off. It will go into the smaller of the two holes on your processor, connected by a little adapter that VetOvation will provide you, and then the other end of your suction tubing will connect to the top of your handle here so that you can now give air as you turn your pump on. As you depress this button, you can now give air into the patient, distending the working space that you're in. If you want to take pictures, you can tap 1 for a picture, you can tap 2 for a video. Then you'll want a standard IV tubing set, and the other end of that can go to the side of your adapter here so that you can run fluids through the lumen of your scope and into the patient. This is our video otoscope. It is a scope with a working channel that attaches to the camera head and then gives you a bifurcating adapter on the side of the scope, enabling you to connect an IV bag with a lure lock to the side of the scope, as well as introducing a flexible grasper down the lumen of the scope to be able to run fluids at the same time that you're removing hair or debris or taking a biopsy or removing a polyp. Our suction irrigation system attaches to your standard IV bag along with your floor suction. Depressing the forward button introduces fluid down the lumen of the scope through the red rubber catheter. Depressing the back button activates suction to your suction canister, so now you can suck and irrigate, breaking up debris inside the ear. The multi-purpose scope is 2.7 millimeters in diameter and comes in either a 0 degree or 30 degree option. The multi-purpose scope is frequently used for rhinoscopy or cystoscopy in a female dog. The system consists of the following parts: the shaft, the obturator, and the bridge, along with the scope. If performing
Cystoscopy utilizes the shaft and the obturator. The obturator then protects the tip of the shaft so that it's not traumatic when it's introduced into the patient. Once introduced, remove the shaft, then introduce the bridge. That locks in place, and the scope can now be introduced down the shaft and locked into place. The shaft has 2 stopcocks on either side to run fluids, and a grasper can be introduced down the working channel. Attach the camera to the side of the scope.